Hello, everyone. I'm Dr. Erin Wells from Mountain Ears Hearing Clinic in Parkersburg. And today I was just going to talk about a couple different subjects. The first subject is something that I'm very passionate about, and it's about the social, physical, and psychological consequences of hearing loss. And that's something that people don't typically talk a lot about. And the other one is, what do we do when hearing aids are not enough? So to begin, I just wanted to talk about those social, psychological, and physical consequences. I think everyone who has hearing loss or has been around someone with hearing loss understands that people with hearing loss avoid social activities. They feel like they want to withdraw from those activities because they have anxiety about not being able to hear what's being said, not feeling like they're being included in the conversations, and that just makes them not want to interact in that manner anymore. You feel like you are a little socially rejected at times because people don't always understand hearing loss. Even if you do have hearing aids, it doesn't completely fix the situation. So, whenever you're in a conversation, when you feel like you're not understanding people become irritated with you because you're not understanding, it makes you not want to join in any longer. So they feel like people are being unhelpful to them. Socially, you also just feel embarrassed. You feel embarrassed for having to ask people to repeat themselves a lot of times. You feel like all you're doing is saying, huh, what, can you repeat that? And people feel like they're being a burden, which I tell my patients, you're never being a burden. You always want to be an advocate for yourself, and you always want to make sure you tell people, I really want to know what you're saying. So if you could do this for me, that would be really great, because avoiding those social situations is not going to be good for your overall health later on. There's a lot of social psychological consequences as well. So you put a lot of stress on your body whenever you have hearing loss. If you have high stress, that means you have a higher risk of cancer, heart disease, and other types of risk factors with that. But stress, whenever you're in social situations, you're going harder as someone with hearing loss than you do when you have normal hearing. You're constantly straining to hear people or straining to understand on a phone, just to do your daily activities. You're adding an extra stress to you physically, but also mentally, just knowing, oh, I have to go to a meeting and I might not understand what someone's saying, or I'm going to have this class at church, or we're going to go to worship and I'm not going to know anything that's going on. That can be pretty stressful on people. And then that can lead to depression as well. When you feel like you're stepping back from your social situations, you're not as happy with your lifestyle because you're not doing the activities that you wish you could do. You feel like people don't understand you, that you're just having a hard time. That can lead to depression. And then we all know that diminished psychological health can lead to other physical issues. The mind is very powerful, so it can just cascade and lead to other physical things to happen. The physical things, you have reduced alertness and an increased risk to your personal safety. So if you're not hearing doorbells, which I don't know if you heard in my video, my doorbell was going off just a few minutes ago, but a lot of people with hearing loss feel like they are not going to hear the doorbell well if someone's knocking at their door, if there's a fire, if there's alarms going off. That's a risk to their personal safety. If you're not hearing emergency vehicles, it just makes people have more stress about that. I have patients that want to wear their hearing aids even when they're sleeping because they have so much hearing loss that it just makes them feel safer and better. So when you have hearing loss and you're sleeping at night, you just have more of a risk of not hearing those types of alarms. Reduce job performance and earning power. And that's not because hearing loss makes you not be able to perform a job or be as capable. It's more of a misunderstanding between the employer and the person with hearing loss. A lot of times people try to hide their hearing loss and they don't want to talk about it with their employer. So whenever their employer is giving them directions or trying to talk to them about something going on at work and they feel like that person is not listening to them or they're not following the proper directions, then it can lead to that misunderstanding that you're not capable when you are, you just have some hearing issues. There's negative long-term effects on brain function and memory with hearing loss. So studies have shown a direct link between hearing loss and a decline of cognitive abilities. And that's the next thing I was going to discuss was dementia in hearing loss. That is definitely one of the biggest things that they're doing research and promoting right now, awareness about. Hearing loss is the #1 modifiable risk factor for dementia. And the reason is it affects you in 3 ways. You have cognitive load, change to brain structure, and then you also have that added social isolation. So the cognitive load is whenever you have to work harder to perform your daily tasks, you're robbing those areas of your brain. So whenever you have to use your vision and other types of senses to help you in those listening situations, you're using other parts of your brain that you normally wouldn't be using if you had normal hearing. So your ability to hear and understand on a daily basis puts strain on your brain, and that can just add an extra load to that brain and that auditory cortex, and it just makes it have more memory loss, and it slows down the processes. Changes to the brain structure, those parts of the brain that handle those sound processing can atrophy and shrink faster when you have hearing loss. I tell people it's like if you don't use it, you lose it. Your hearing doesn't stop at your ears. It goes and is processed to the brain. And if you're not using that pathway, your brain will say, okay, well, I'll use this for other types of resources. And so it starts to rob that part of the brain starts to atrophy, and it just becomes a more of a cascading effect and deplenishes some of those areas of the brain. And then the last is, of course, that social isolation. So we know that hearing loss can cause individuals to engage less in those social activities. They slowly give up activities, and some will completely withdraw. And scientists have long known that social isolation in older adults is a direct risk factor for poorer health outcomes. I know anytime they talk to patients about dementia, they're saying be active, keep your brain active, do puzzles, do little mind exercises. And it's the same thing with the ear. You don't want to forget about your listening. If you use that pathway, you're exercising that part of the brain. So whenever you have a mild hearing loss, you are 2 times more likely to develop dementia. And if you have a moderate hearing loss, you're 3 times more likely to develop dementia. And if you have a severe hearing loss, you're 5 times more likely to develop dementia. So the more severe your hearing loss, the more of a risk that you have at dementia. And that's because the more severe hearing loss you have, the harder it is for you to pick up those sounds and interact in a normal way. Now, this is all research based on people who are not amplified. So that risk goes down whenever you seek attention for your hearing loss and whenever you use the appropriate amplification. So if your ears are being stimulated like they're supposed to be and you're still being active, then that will definitely help lessen that risk. So hearing loss in adults has been linked to an increased risk of falls, greater risk of hospitalization, and requiring institutionalization and poor physical functioning. So as we talked about that cognitive load that affects the overall brain resources, that just throws your body off physically as well. And hearing loss affects your ability to monitor your environment. So hearing someone approaching you, their footsteps, it just makes things a little more difficult in those situations. Like I said, amplification is the most appropriate way to take care of that in most cases. People have different types of hearing loss. The most typical is just from age, from genetics, from noise exposure, maybe at your jobs. And typically that is just helped with amplification. And then you have some people who have some medical conditions in their ears, and that needs to be addressed by a ear, nose, and throat physician, which also can end up with amplification in the end as well. The second topic I wanted to talk about was when hearing aids are not enough. So hearing aids, they help you hear. They are not going to fix your ears. So I think that's one of the biggest things that people don't always understand is wearing hearing aids is going to help, but you're never going to have the normal hearing that you had previously. So hearing aids are lots of different technologies, and based on the technology, it's going to tell you what kind of help the hearing aid is going to give you in different social situations, different environments. So the higher the technology, the more it does automatically and makes adjustments according to your listening environment. And then as you go down in technology, it's going to be automatic, but maybe not switch as quickly or where you think it should, and you might have to do some manual adjustments. So whenever you have hearing aids that are appropriately fit, but you still feel like you're struggling in some of those situations, we have some accessories that people have with their hearing aids that can assist in those areas. So one of the things that I have is a TV connector. So if you have problems understanding on the TV or hearing the TV, even though you have hearing aids, that happens a lot. Hearing loss doesn't just diminish your volume of sound, it diminishes the clarity of sound as well. So even with the hearing aids, you might have some problems with the TV. I also sometimes have people who, of course, have the spouse that has maybe better hearing than them, and they don't want to have the TV at different volumes. So with the TV connector, this links to your hearing aids wirelessly. There's a wire that hooks into the TV. And I tell people it's kind of like hooking up like a DVD player or something like that to your TV. So this just sits beside the TV, and it would either automatically connect in some cases, or you would manually tell the hearing aids to connect to the TV connector, and it would stream whatever is going on the TV to your hearing aids. And that way you get your own personal sound, and it cuts back on the issues with clarity. It has volume control on here, so you can actually adjust the volume as well. Typically, once people adjust the volume the first time, then they can leave it and it's good for the rest of the time. There's also, if you do not have hearing aids, or you don't want the TV connector for the hearing aids, they do have different types of TV ears, which is just a wireless headset that you wear that connects the TV system to your ears so that you can hear clearly. I have some people who maybe are starting to notice they have hearing loss, but they're not quite ready for hearing aids, but their spouse is very upset with them about their TV listening habits. So they just get TV ears, and that helps with that issue. Another thing is this device here. And what this is a phone connector and microphone. So it has a little clip on the back, and you could clip that to your shirt. You also can set it on a table. The microphone portion of it is to pick up the voice coming into the microphone and taking it straight to someone's ears through their hearing aids. So if you have someone who has poor clarity or poor understanding, they'll have maybe issues riding in a car with someone. If you go on a long road trip and you want to have a conversation with someone, it can be hard whenever you need to look at people to understand what they're saying. So if, say, your spouse or your friend wears this microphone and it's connected to your hearing aids, it would go stream directly to your hearing aids. That way you hear their voice through that. The other way you can use it is putting it on a table when you go to a restaurant or have a family dinner. Then it can help pick up those voices and take it to your ears so that you can help compete with some of those noisy situations or those group conversations. This one is also a phone connector. So if you happen to have a phone that has Bluetooth, but maybe it doesn't have the same type of Bluetooth you need to directly connect to a hearing aid, you can use one of these devices, and it would directly connect your hearing aids to your cell phone. So a lot of people with hearing loss have problems hearing on the phone. And that's because you can't see someone when they're talking to you. I just had this conversation with my new receptionist today. I was instructing her on how to talk over the phone. When people have hearing loss, you need to make sure you slow down and pronounce your words. If you're leaving a voicemail, we need you to slow down and pronounce your words as well. So when they're getting that message, they can understand it. So whenever people talk to me about having problems hearing on the phone, it's typically how they deal with it is by using their phone on speaker. And that is fine. You're using both ears, and so you get better hearing with two ears, but then everyone around you can hear your conversation. So what the hearing aid companies have done is they have the ability for your hearing aids to directly connect to most smartphones. They also have these extra devices. If your phone doesn't connect to that phone, it can link through those to go through your Bluetooth. And whenever it's streaming, you'll hear through both hearing aids. So it gives you that binaural hearing, which gives you better understanding. And then you're hands-free and you're not letting anyone else hear your conversation. So that's been a benefit for a lot of patients, being able to stream their conversations through the cell phones and getting better understanding. The other great aspect is I have patients who maybe like to go on walks with their dog or go do some exercise. They can wear their hearing aids and stream music from their iPhones or Androids, and that's a nice benefit as well. As far as phone systems, just in general, like a landline, they have caption call phones. And if you can see that, the phone has a receiver and it has a volume control. And then it actually writes out everything that's being said in that conversation. So that's a free government program. We all pay taxes on our phone bills, and that goes to a fund that pays for this for people with hearing impairment. So you would just go to your audiologist and they would make sure that you have a hearing loss, and we just fill out an application for you and send that in. There used to be some stipulations about having landlines and internet, but they've taken away some of those barriers. So most people are able to get that in their home. And whenever they're talking, they can see what's being said because it's written out. The other benefit or accessory that people are liking, I'm going to pull up here, are apps with hearing aids. So hearing aids, like I said, are going to make adjustments according to your listening environment. But whenever you're in a certain situation, you might want to make a few adjustments. Of course, on the hearing aid, you can typically make some sort of adjustment, but it's sometimes better to visually see it. So if you have an app, you have on here a volume control that you can scroll up or down, and it will change the volume on your hearing aids. Another great thing that some of the apps have is this directional hearing. And so what this is showing is whenever you have hearing aids, they have directional microphones. So when you get into noise, it's supposed to focus in the front, cut some noise in the back, and on the automatic session, it's just going to make adjustments accordingly. But if you say go to a restaurant and you're with your spouse, you can maybe go into your app, click that arrow ahead, and it gives you a different plot. So that red part, it is increasing the volume, and the bottom part, it's going to be decreasing the volume. And I can even focus it even more. Say I'm sitting across the table from my husband. I can focus it directly on him and be cutting the background noise around me. So a lot of people are liking this whenever they have certain situations where the background noise is just too much. If you're in a car with someone, there's even arrows on the side where you could go to the side and hear from the side, hear from, sorry, my phone's messing up, hear from the other side or the back, or you can just go back into automatic. So the apps are different for each hearing aid company, but they do have different types of controls to give you that little extra feature of helping you. Because hearing aid companies know that there's going to be situations that the hearing aids might not fully do what you'd like, and that gives you the power to make some more adjustments. Another thing that's been a popular topic in my clinic lately is what do you do if hearing aids are maybe not an option? If you have a family member who's maybe in hospice care and maybe lost their hearing aids, and they just never had hearing aids but they're having a hard time hearing, or some family member with dementia and they've lost their hearing aids, or you feel that they would probably throw them away or forget where they put them, or they don't want to wear them, but feel like you're screaming at them when you're at family dinners or family functions or going to visit. We have things called pocket talkers. And these are obviously a lot less money than hearing aids. It is a little piece that has a clip on the back. And so that can clip on a shirt, on a belt, and it comes with two different types of headphones. You have just like your little earbud headphones, or you have the ones that just go over your ears, and it just plugs into the side. So all you would do is turn it on, and you have a volume up and a volume down button, and the microphone there just amplifies people's voices. So I've had people who are like in nursing facilities, and all they want is to be able to turn their TV down. So the staff is able to put these headphones on them, turn the volume up, and they're able to hear better. Or a family member goes over and they want to have a conversation, get out the pocket talker. People are a little more less resistant to this temporary type of device in certain instances. So this is a pocket talker, and they run about like $190 for this device versus hearing aids. Another thing to consider is when hearing aids are not enough, you've worn hearing aids and maybe you've worn them for years and you just get less and less benefit from the hearing aids. And that's most likely because of the diminishment of your hearing. Your hearing has gotten worse, your clarity has gotten worse. And the last option would be a cochlear implant. So a cochlear implant is this device here. There is an internal component and there's an external component. So whenever those nerves are so damaged that you're not even getting benefit from a hearing aid, what we would do then is do a cochlear implant evaluation. And that is done with hearing aids to see what the benefit is for them. And then we would refer you, if you need a cochlear implant, we'd refer you to a surgeon and they would talk to you about the cochlear implant surgery. And what they do in the surgery is they have this portion, this little tiny piece, it looks like a little seashell, if you can see that at the bottom, that goes inside your cochlea here. And there's a little electrode. So instead of hearing acoustically like you would with your natural ears or hearing aids, this would electrically stimulate the nerves in your ears and give you better clarity or understanding. This piece is just the electrical components or like the processing components and a magnet, and it just sits underneath the skin. And so in this portion, it's right here. So that heals for about 3 weeks, and then you would come see your audiologist. So I'm a member of the Cochlear Provider Network. I use a surgeon in Morgantown, but all the rest of your visits would be done by your local audiologist. And it's about a year of rehab, doing exercises and programming that implant. But there's two processors. There's an over-the-ear processor. This portion connects to that magnet under your skin, and this sits on top. And then there Hanzo, and it's just one piece that sits on the skin. And they come in different colors to try to match hair or skin. But again, that's kind of more of a last resort when hearing aids are not enough. But they do change people's lives. I have a few patients who have them in the area, and they're able to be social again, able to be active, and it's really changed their lives. And of course, you never want to forget communication strategies, just getting people to slow down and pronounce their words, look at you when they're talking, getting your attention. Maybe if you're talking to your spouse, remind them, don't talk to me from another room. Make sure you get my attention or come into that room that you want to talk to me in. Maybe turn the TV down, turn the noise down so that I can understand you, and then make sure it's a well-lit room. You're not going to hear very well. I know people say, well, if I can't see, I can't hear. That's definitely true in a lot of cases. So that is everything that I have to go over today. And I hope that gave people some good information to think of. If you ever have any questions, again, I'm at Mountain Ears Hearing Clinic in Parkersburg, and I have a Facebook page, a website, and our phone number is 304-917-3742. Thank you.